Hello to everyone. In this video, we will be discussing on the topic of the metastasis of liver tumors. So now, liver is an organ into which tumors from other parts of the body often metastasize. Okay, so the meaning is that in the liver, the cancer, the primary position of the cancer, that is the origination of cancer, can be on the other part of the body, like on different organ, but the metastasis which takes place is most commonly occurs in the liver. So liver is the most common and prone organ for the tumors of other regions. So now what is the reason behind this is that hepatic blood flow make the liver more vulnerable to the secondary damage by the malignant cells in the other regions. Okay, so this hepatic blood flow is only the reason because of which the metastasis takes place in the liver, and that leads to the liver tumors. So it is a secondary, and the metastatic liver damage is often observed in the neoplasms of the large intestine, lungs, neuroendocrine tumors, gastrointestinal intestinal tumors, breast cancer, stomach, and tumor of pancreas. So these are the common regions in which the metastatic liver damage occurs. Now, metastasis of colorectal cancer to the liver. So colorectal cancer is the fourth most common malignant neoplasm in the world, and this metastasis of colorectal cancer is the um, most common type of metastasis to the liver. So the most common region is actually colorectal region, that is called as colorectal cancer or the colon cancer, which metastasize to the liver. And out of all the cancers, colorectal cancer comes on the fourth position as a malignant neoplasm in the world, and approx 50 to 20% of patients with colorectal cancer have synchronous liver metastasis. So 15 to 20% of colorectal cancer patients can develop liver metastasis, and when they are admitted to medical institution, and 50% are predicted to develop in future. So after admission to the hospital also, the chances of 50% of development of this liver metastasis in the future. Now, diagnosis of this metastasis is carried out in two situations under the dynamic observation after the removal of the primary colorectal cancer. So when the removal of primary colorectal has been done, then we see that there is some metastasis to the liver. And the second case can be like when we see the multiple liver lesions in the patients without a history of the primary cancer. So if there is no history of any cancer but there are multiple liver lesions, so that can be also the situation for diagnosis. Now, diagnosis of spread of the colorectal cancer is done on ultrasound, CT, MRI, and most commonly the CT is the most common method to detect this metastasis. Now, cancer markers which we can do to confirm the colorectal cancer. So for colorectal cancer, spread of colorectal cancer, we use cancer embryonic antigens, that is called as CEA, as the most widely and used marker for spread of colorectal cancer. And the marker like CA19-9 also useful in disease progression, that is the spread of the colorectal cancer. So this CA marker is also most common in this cancer divisions. Okay, and you can see in this image, this is the image of the MRI. You can see this MRI scan showing two lesions in the left lateral section and one in the caudate lobe. So these you can see the black dots. You can see this is the two lesions in the liver, and further stage like 1B figure, you can see scan showing multiple metastasis. You can see the black dots. So these are the multiple lesions, metastatic lesions, and further you can see the post left partial hepatectomy. So partial left side of the partial hepatectomy has been done here, and caudate resection also is in this. Here you can see this part, and here after CT scan 2 months later, right hepatectomy showing no evidence of the disease. So this is the CT you will see here, and this is the metastasis as you see. So this is the metastasis example of the lung carcinoma. So this the primary tumor is in lung, but through the blood vessel the cancer cells can go forward through the RBCs and then can go to liver, and this is the metastasis. So this is the basic meaning of the metastasis. Okay, Now let's move on to forward. Now the treatment or therapy of the colorectal cancer metastasis to the liver is, we can do the surgical intervention in the first line therapy for the patients with resectable or operable liver metastasis with a 5-year survival rate, and this is about 25 to 58%, and 10-year survival rate is about 20 to 39% in the case of surgical treatment. Now schemes of perioperative chemotherapy is also based on oxaliplatin and the irinorectin. So these are the chemotherapeutic drugs which can be also given to prolong the life of the patients through chemotherapy. And most common additional methods of treatment of the liver metastasis. So this is the most common additional method after the surgical treatment. This is the most common method for the treatment of liver metastasis. And if we talk about the unresectable liver metastasis, that can be treated by radiofrequency ablations, microwave ablations, hepatic artery infusion, radioembolization with yttrium-90. So this is the radioactive substance which can be used to treat the unresectable, that where the surgery is not possible. And when colorectal metastases are isolated in the liver and unoperable, the 5-year overall survival rate ranges from 25 to 58%. So if the operable colorectal cancer is means diagnosed, and if the operation is done on that patient with colorectal cancer, then survival rate is about 25 to 58% for 5 years. Okay, so this is the main, you can see the case of colorectal cancer, and you can see this is stages for the colorectal cancer. This is the pre-operative. You can see some red dots here, and these red dots are colorectal liver metastasis. There's red balls you can see, and this is the first ALPPS stage, in which you can see the segment resected during the stage 1. So segment is already resected, this segment, this much only. And in this you can see in the stage 2 ALPPS, segment resected during the stage 2. So this full segment has been resected, and this segment is undergoing the hypertrophy. Okay, and hepatic and bile duct ligation has been done. Clear? And this you can see the example for the metastasis of the primary colon cancer, you can say, or colorectal cancer, which is going to metastasize to the liver through the portal vein, and metastatic colon cancer to the liver. And there's a blood based biomarkers you can do CA, as I told you, and CTC and exosomes, all the, and these are the modulations of balance of the risk. And okay, so these are the immunomodulators and all chemo preventions. So this is the main scheme, you can see the main image you can create in your mind regarding this. Okay, and now let's move on to further for the metastasis of neuroendocrine tumors of the liver. So these clinical manifestations like neuroendocrine tumors often clinically are asymptomatic. There are no symptoms, but after spread to liver they show some symptoms like pain in the right hypochondrium region, feeling of rapid saturations, jaundice, weight loss, hepatomegaly. So enlarged liver, weight loss, jaundice, these are the symptoms. And functional neuroendocrine tumors most often arise from cells of the jejunum. So functional neuroendocrine tumor develops from jejunum, ileum, cecum, and can secrete active hormones including serotonin, which can lead to carcinoid syndrome. And the syndrome is actually most common in liver metastasis patients. Okay. Now we have some carcinomas like lipomas and gastromas also originate from pancreatic cells, and they have but 3 classical signs here, like watery diarrhea, hypokalemia, low potassium, and achlorohydria, that is the low secretion of acid in the gastric mucosa. Now these are the 3 signs you can see with gastromas and lipomas, but gastromas also show some clinical features like epigastric pain, recurrent duodenal ulcers. Okay, and tumor of pancreas and small intestines have worse prognosis. So prognosis meaning that they are very much chances of recover for the patient. So they have worse prognosis for the cancers of pancreas and small intestine. Now we talk about the non-colorectal and non-neuroendocrine liver metastasis. So liver, as I told you, most common place of metastasis, not only of malignant neoplasm of GIT, but also of many cancers like ocular melanoma is of eyes, or medullary thyroid cancer. So thyroid cancer. So these are also the cancer like colorectal cancer. These are also the places which can metastasize to liver. So that they are comes under the category of non-colorectal liver metastasis. And the patients with primary genitourinary diseases show better treatment results, while patients with GI, that is a gastrointestinal tract disease, skin tumors, have prognosis less favorable. That meaning is worse prognosis for the GI and the skin cancers. And treatment for this can be surgical removal of neuroendocrine liver metastasis can improve survival, but recurrent rate is high. So if you remove any tumor by surgically, so it can improve the survival or prolong the life, but the recurrent rate is very high. Okay, and you can see this image, like for the colorectal cancer, you can see this you can see the CT findings here, CT images, and liver metastasis, black balls. So these are actually the liver lesions, and this is the gross image of your liver. So you can see numerous metastases. Tumor cells were arranged in the nodules and occupied approximately 90% of the hepatic parenchyma. So low density metastasis for both lobes of the liver. So both lobes of the livers are damaged here. So this is the metastasis from the colorectal cancer, colon. And summary, if we say liver is the most frequent site of the metastasis or tumor of GIT due to the mesenteric venous outflow through the portal vein. So portal circulation, because of the portal circulation in the liver, so liver becomes the most common organ for the metastasis or tumors of gastrointestinal tract, that is the colorectal cancer or cancer from small intestine, okay, rectum, pancreas. So all these regions, and skin also, so they have worse prognosis. So patients are means there are less chances that patient can survive for long duration. So this was the metastasis of liver cancer. Thank you.